you. People joining online as well. I'm Dr. Lillian Yundodo. I serve as chair of biomedical sciences at the new College of Medicine at Baptist. And I'm also co-chair of the Baptist Health Corps that pretty much hosts this program. She leads the way. So I'm going to go ahead and introduce our speaker today. We're excited to have Dr. Jamila Smith-Young with us today. And our host or moderator is going to be Dr. Brianna Yeager, who's chair and professor of health administration and public health at Baptist University as well. And she's my co-chair of Baptist Health Corps as well. Don't mind me, I had to read because she's amazing. All right, so Dr. Jamila Smith-Young is a nurse practitioner with a certification in pediatric acute care. She's a native Memphian and has spent over 14 years in the healthcare field, specializing in endocrinology and pulmonology. She currently practices as a pediatric endocrinology nurse practitioner for UT Labana Pediatric Specialist, focusing on diabetes and other endocrine disorders. Dr. Smith-Young contributes to the careers of current and future nurse practitioners as an assistant professor and mentor in the College of Nursing at the University of Tennessee Health Sciences Center. She serves as a co-investigator on a number of clinical research projects related to pediatric diabetes, hypothyroidism, and most recently, a HRSA grant focusing on social determinants of health and health equity. She is a published author and has presented at national conferences focusing on diabetes and pulmonology. Dr. Smith earned a Bachelor's of Science degree in microbiology from University of Tennessee, Knoxville, and nursing from Baptist College of Health Sciences. Woohoo! She expanded her nursing career early on by obtaining a master's degree in nursing from University of Alabama, Birmingham, and a public health from Walden University. She later earned a doctoral degree in nursing practice from University of Tennessee Health Science Center. She's the founder of Forward 901, a 501c4 whose mission focuses on enhancing the overall quality of life in Memphis by supporting programs, activities, and events for youth and disadvantaged populations. Dr. Smith-Young is the wife of the Memphis mayor, Paul Young, who's here with us today. Thank you, Mayor. Together, they're a dynamic duo in this community. They have two children, Zoe and Paxton. I'm going to hand it over to Dr. Yeager.
Well, thank you so much, everyone, for being here. We'd like to start our program today by hearing from Dr. Smith-Young about her journey to becoming the wonderful, awesome nurse practitioner, healthcare professional, leader in our community, wife, mother, and friend of Baptist. Take it away.
Can you all hear me? Yes. Okay. So thank you for the wonderful introduction. I don't know where she went. Oh, there you are. Thank you. This may not work, actually. It's fine. I may have to stand up. I'll stand up for a while. It's fine. So, as she already stated, I am a pediatric nurse practitioner in endocrinology at Le Bonheur Children's Hospital. I also serve as an assistant professor at the University of Tennessee College of Nursing. I am in the program for pediatric acute care nursing for students that are getting their doctorate degrees. These are just a few pictures as I tell you about my journey. So she already told you about my degrees and all the things that I have. So I'll start off from the beginning. I was born and raised in Memphis, Tennessee, went to White Station High School. And as a student, I always enjoyed the sciences and math. And so high school, I took AP biology, decided that I wanted to do something in healthcare, but wasn't quite sure what. But I knew I wanted to be a science major. So went to the University of Tennessee, Knoxville, and started the program of microbiology, which thoroughly enjoyed it, and still, getting my background prereqs for whatever I decided to do. One thing that I did as a college student was explore and shadow and just talk to other professionals throughout my time, just to see what it was that I thought that I would want to kind of focus on when I became an adult. So when I graduated with my bachelor's degree, I decided to go into research. And so I did asthma research for the University of Tennessee in Le Bonheur. And so some of the things that I did on a daily basis was run a lab. And I did lots of experiments on some animal-based models just to try to prevent the animals from having asthma exacerbation, better known as an asthma attack. And so I did that for a few years and loved it, but at the same time, I was by myself in the lab every day. And for me, I needed to see and be around people and talk to people. And so it was kind of a pivotal moment in my life where I was like, okay, what do I want to do? And so after talking to people and just kind of seeing the atmosphere that I saw at Le Bonheur, it's like, nursing is this is my calling. This is what I need to do. And so I enrolled into Baptist. I'm at the time Baptist College, and now it's CBHSU. And so At that time, I actually was getting married upon graduation. So pregnant with my first child. So I did a lot while I was in school, but it was doable. So once I finished with my bachelor's, I ended up training and doing some work at Methodist University, where I did adult med surge, and quickly learned that it was not my space. It wasn't for me. And that's the beauty of nursing, which in other healthcare fields, but nursing, there's so many avenues that you can take with it. So many different things that you can do, whether it's being a clinician, can't hear me, being a clinician or research, educator, doing public health with nursing. You can do adults, you can do labor and delivery, pediatrics, so many things. So I chose to go into the pediatric route and have not looked back. So, and these are some students, like high school students, that I do summer programs with, where they'll come and shadow during the summertime. They're interested in healthcare profession. There's also some of my doctoral students that we did things during the pandemic when we were doing vaccinations and things when people were at home being safe. We already talked about my background. And so I kind of explained why microbiology, why nursing, why the public health piece. That's more so learning the policies of healthcare. I wanted to see that side of things and where we had, the epidemics and pandemics and how to prevent certain things from expanding in our healthcare world, whether it's locally or globally. So that sparked an interest in me to have that extra layer of education so I can know how to treat a patient, what I can do to make great efforts towards preventing something from happening globally or locally. So some of the challenges that I faced, this is my actual graduation picture from Baptist. I found it thanks to social media. And so the young ladies in this picture, so we met in school, and one of the challenges that I faced was learning how to study differently for nursing. And it was a struggle initially because I never really had to study before for my other degrees and in school, microbiology and all of that. And this was a different way with concepts and theory and everything. And so I met these young ladies my second semester in the school, and we formed study groups. And when I say every weekend, sometimes after class, we were together at someone's home doing flashcards, study guides, and I credit them for helping me get through because I had someone to talk to that was going through what I was going through, but also we got through it together. So that was the hurdle, just making those connections and finding people to be your core that are going through with you. Then my other challenge was balancing family and work. I did have to, of course, quit my job initially once I started nursing school because it was just too much the demand. But it was all doable. And like I said, I don't regret it at all. And I'll be quick because I know you want to ask questions. As far as my early nursing experience, so I was a nurse extern. Like I said, I did med-surg stroke initially. And then I decided to go over to Le Bonheur and start in the pulmonology unit. So anything with bronchiolitis, asthma, flu, anything with your lungs, that's what I dealt with on the floor. Eventually became a charge nurse. And then I started doing quality improvement nursing to make sure that our hospital was doing all the things, sending patients home the way they should be to be successful when it came to our asthma patients that were coming back multiple times for ED visits. And so making sure that we did what we were supposed to do to make them successful. So that was my early on career. And so part of these pictures, I just like to tell about the pictures too. At Le Bonheur, one of the reasons why I chose this, field, pediatrics is what I'll say, not Le Bonheur, but just pediatrics. Children are resilient. And so one thing about pediatrics, you're going to have someone smile and laugh at you at some point during your day. And that means a lot just to have that sometimes in those difficult days. And so it helps me, each day, no matter how hard of a day it is, I know I can make someone smile, but they also make me smile. So that was another deciding factor. So this is Halloween. We have people that come, characters all the time, to have fun with us. So my decision, as far as pursuing further education, getting a master's in nursing and a doctorate, at the time, there were not any pediatric programs in the city. So I had to branch off, but now that's changed. And so I wanted to specialize in pediatrics because I loved it and I knew this is what I wanted to do. But I also wanted to have that autonomy to be able to practice and just make those connections with families that I could see other people doing that I knew was inside of me. And I love to strive and do the most. And so part of my thing is I want to go till I can't go anymore. And so I chose to get a terminal degree, getting my doctorate, where, I make sure that I accomplish that goal of being the best that I could in my profession. And so I'll just stop right here and we can ask questions. I know this will probably be a lot of your questions right here. So.
I'm here to just bask in the awesomeness. So, thank you for that. That was wonderful, and I think, as you can tell, this is one very accomplished human being, and we're very blessed to have you with us today. So, we did have some questions, some that the students submitted as they registered, or others sent to us to just, go a little deeper and talk about, you spoke about how you kind of found your career, and it reminds me a little bit of my own story. I always felt like I was like, and now I'm going to do this, and I just never stopped growing. It was just, I love that. But what were those aha moments? Like, if you had to pinpoint that aha moment for any of those decisions, what would you tell all of them it looked like?
Going back to when I was doing the research initially, I had some fellows and residents that would kind of rotate in monthly to do some of the experiments and protocols that I was working on. And so they would let me come along with them sometimes to go see patients in between doing some of my trials. And so it really inspired me. And I was just like, oh my gosh, this was it. Like, this is what I need to do. And it's like, it's the best of both worlds. Like, you still tie into the research because people are doing that piece for you to be able to practice, but you're also, engaging with families, and with children, it's the family. It's not just the child that you're treating. So building those relationships and things. So that was one of my aha moments, just like being able to kind of shadow with them randomly. And it's like, this is what I need to do.
I love that. And I agree, because I started my career in lactation, and it's a dyad or it's a triad. It's everyone in that. It's not just the baby. It's not just that lactating parent. It's the whole family is a part of that journey, and it's so much fun. We also had several questions, and this slide is really great for that, about your tips. And there's more than 3 on there. So I'm gonna limit. We're gonna have a TED Talk moment and say, what are your top 3 tips that you would give for those aspiring to enter the healthcare space?
My top tip would be for high schoolers, middle and high schoolers, I would say, just getting involved in things, whether it's volunteering for community health fairs or, being a part of your health club at school where you guys are doing some type of service or being exposed to something in the healthcare field. That way you can kind of see, is this really for me? And it always can kind of weed out a few people when you kind of do some of the experiments where you're either doing dissections. Like, I had several classmates when we were in AP biology, when we would do like dissections, and it's just like, oh, not for me. Or, the sight of blood or things like that. So just being exposed, but making those connections. So one, like I said, get involved with school, community. And then the other one is just networking, talking to people. I was a shy kid initially, it took time for me to get out of my shell, but just talking to individuals that are around you, or whether they're at church, school, any type of organization that you're in, that are in the field of healthcare, and just asking about their journey, like I'm telling you today, and just making those connections, because sometimes that can open doors for you. And it happened to me with, when I graduated with microbiology. I didn't have a job right away, And so I was working at a clothing store for a little while, and I ran into a person in the store and told them what I wanted to do. And she's like, I actually have a friend that's looking for someone to be a researcher. And just like that, I got introduced into my field and into my job. So just, opening your mouth and talking, networking, if you know what you want or you have an idea of what you want, speak up, speak out about it. So that's 2.
I love it. Keep going. What's number 3?
The third one, I would say, definitely get mentors as well. If you're in that high school collegiate area, having a mentor that's kind of gone through things before you would be good as well.
Oh, that awesome. I think that's really true. And it's so hard sometimes to put yourself out there, but you just never know. You just never know. So we did also have some questions about obstacles and challenges. And, I think I coach. And so I know you learn a lot more failing sometimes than you do succeeding. What would you say was your biggest or most impactful either challenge or failure? And what helped you get through it? What helped you face it, persist, and come out on the other side?
Definitely the challenge, kind of like I stated before, just learning how to study in nursing. And not doing so well initially at the beginning of a course, and having to make friends. So, I was a little bit older than some of the students. So just having to engage and meet people and talk to your classmates. And so me finding those people who are like, hey, come study with us. And just learning how to reprogram myself with studying. So that was a challenge initially. And then I got very good at it, and it just got easy after a while. But I don't think I would have had that success if I wouldn't have reached out and talked to some of the students. But that class was a struggle for me.
Oh yeah,
like we all have 1 or 2 classes in college, maybe high school, that are a little challenging, that require a little bit extra.
I teach statistics and economics, so I'm the other side of patho. It's one or you're struggling in one of the two. Yes, patho is a wonderful class. We love our patho teachers.
I love patho, yes.
But it is the great equalizer in nursing school.
It is.
For sure. Oh yes. So another question that and I kind of took a bunch of different ones and they all fell under a theme. So I took some moderator privileges and started marrying them. Is that, there are unique experiences and challenges that women, especially Black women, face in healthcare and STEM. Some of the themes that the questioner submitted had to do with how do you balance those demands of work and family? And you went back a little older, and I see, we had Zoe, right? So you're not just a student, you're a mom, and that's it. That brings its own set of things to me. And there's also this thing, especially for women, all women, Black women, all women, about, being questioned about whether you're qualified or you're deserving to be in that space, you're worthy. So what advice would you give our audience members about how to be the successful person you are? And it's not just that you're a successful Black woman, you're a successful person. And I think that it's important to celebrate both, but also to help us change the narrative going forward. So what would you say?
So definitely finding your village, whether with or without kids, you have a village. You need those friends or family members that can make you kind of just go away for a second if you need to take a break, because sometimes it can be overwhelming, just school in general, or just thinking about what you have to do in 2 weeks or a month from now when it comes to your school. So just having those people that can kind of give you that normal side of life, but also support you when you are feeling down or encourage you. So I always had, my parents and my sister and my husband. I told them I was a lifelong student for the first 10, 12 years of our marriage. But he was that person, like he made sure that, what I need to get done, like he was supportive of that. So just finding that, whether it's family or friends that you make. And when it comes to feeling like you deserve something or that you're supposed to have something, I'm all about a challenge. And I don't let anyone tell me that I can't do something if I have my mind set to it. And what I say is, and put yourself at the table if you have to. If you notice there's something that has not been addressed, whether it's, small group that you're working for or students that you notice that you feel like there could be something that could be changed, be that advocate, be that change agent. And so you speaking up and in a positive way, but just putting yourself at the table so people can recognize that you do deserve things, but don't let anyone tell you that you don't deserve it either. So just always, if you know that you have something, a goal set, and you're doing the right thing, continue to check the boxes when it comes to finishing what you need to do and preparing yourself, but you're just as qualified as anyone else, and you just have to own it. And like I said, don't wait for something. You go for it. Speak up.
Love that. I think that deserves many, many rounds of applause. And I was that same. My doctoral picture looks the same with my one who's now half a foot taller. So I look up at him now. It's always fun. They grow, right? All right. Before we turn it over to our audience for their questions, the last one that kind of came in through the registration and other avenues is that, what is unique to working in pediatrics? And what are some lessons that you have learned that you would give to others who are thinking about a career in pediatrics?
Definitely the unique part of pediatrics is you're, like I said before, treating the family. Of course, children are not, they don't choose their environment that they're brought in. So you have to help to empower them and, give them a better environment. And so you can't just say, this is what we're doing, or be upset with the family. You have to meet them where they are to see how you can make them be more successful wherever they are, whether it's, setting the bar a little higher, but not to the point of where you think things should be, but where you're helping them to have a better outcome. And so pediatrics, I feel like that's the unique part of that. And children, remember things. So, it's traumatic for a lot of children to either be in the hospital or to come to a doctor's appointment or to, get that shot or the vaccine. And so trying to build that relationship and be on the level of a child, it's unique compared to just talking to an adult. And what was I forgot what the last question was. I'm sorry.
Yeah, that was really it. And I'm going to throw a little wrench in there because, I'm chair of public health. So you have that public health background too. And I would ask, how did those two things go together? Because sometimes, everyone says, I found public health later. And it would be great if we found it earlier. So how does those two things go together?
So part of my thing, I always was inquisitive, like I said, about things. And so I was my employer. I got a scholarship. And part of that, just learning all of the programs that we had at where I work, I learned about some community programs. And so with public health, I was able to see the HIV side of things with children and pregnancy. And so I had the opportunity to go to some of the high schools in the area where there were high risk rates for HIV. And so we were going to talk to those students to kind of prevent them from going that route of having unprotected sex. And so just looking at the statistics and all of that locally, statewide, globally, like it was intriguing to me. And so I really enjoyed my time doing that. And so that's what made me pursue the MPH, the Master's in Public Health.
I love that. And one of our faculty members, Dr. Jan Hill, actually was one of the persons that did that program with the Shelby County Health Department.
Amazing.
And we would be remiss if we didn't mention that Shelby County is one of is rising in the rates for HIV. And so for our young ladies thinking about STEM, it's time for a cure. And it would be wonderful to have some of you pursuing and finding that research is a great way. Nursing is a great way to get there. So our students, it's your turn. I know. And this is where we throw you into the fire. You have to ask a question. And unfortunately, I'm a college professor. So like I will go stand next to you and just wait. I'm patient, you know. I don't have girls. I only have boys, so I'm really patient. You know, we'd love to hear from you, and I actually will walk around too, so that you don't have to come to me. You don't even have to get up. You know, I'll bring it to you. You get that side, I get this. All right. Oh, good. We got a question up top. I'll go. I got lower heels. You know, they're not there. I wore the walking shoes today.
Hi, Dr. Smith. My name is Tracy Mendelson. I'm actually a neonatal nurse practitioner, and I'm curious to know about what your day is like, working and also teaching, and how you incorporate both the clinical side and the teaching side.
So a day of life with me is not the same each day. So I do practice inpatient in the hospital as well as outpatient. So my schedule, I typically do 1 week out of the month where I do inpatient consults for Le Bonheur and Regional 1 in the NICU at Regional 1. And so I round on patients that have some type of endocrine disorder or diabetes that are coming in through the emergency department or in the ICU or our med-surg floors. So that's typical week, which I do that, as well as I do after-hours calls a lot of times during that week. And so any families that are what we call new onset diabetes, where they've just been diagnosed over the last week, they usually call in and check in with us every night to just kind of let us know how things are going, how blood sugars are, and also if they need to come back into the hospital. And so I do take sick calls as well. So that's, you know, maybe 6-7 nights out of the month I do that. The other weeks when I'm not inpatient, I'm outpatient. And so I see kids, you know, some of the kids that I saw in the hospital, they come see me afterwards. And we follow up and do follow-up appointments. So I see, you know, patients that have diabetes, thyroid disorders, growth hormone disorders, precocious puberty, things like that. So it's a variety of things from age, you know, a couple weeks old to 21. So that's my typical day. Now, as far as with my students, so I have, you know, students that I precept, and they come with me, you know, during the semester. So this semester I have like 2 students that are with me, and so they will come along, shadow initially, but then they start to practice and learn how to do the daily life of what a nurse practitioner will do. As far as my the grant that I'm a part of, the HRSA grant, so I a couple days out of the week I work on that with a team. So there's a team of 5 of us. And so we work on, I'm over the doctorate program. So anyone that is teaching any course in the doctorate concentrations, I work with them to kind of learn what they're doing when it comes to simulation labs. And simulation labs are where you practice on a pretend patient that looks like a doll. And so they have to develop scenarios for their courses for students. And so I look at them and determine if they have what we call health literacy and health equity, and can prepare a student to learn how to teach, or not teach, to learn how to practice with a patient when it comes to social determinants of health. Like, are we factoring in things where a family can't afford to get medication? We give them a prescription and say, bye, take care, pick up your prescription, but we don't realize they don't have transportation to get the prescription, or they're homeless. So things like that. So that's what I do on the academic side as well, just helping to develop these programs. And we're doing AI as well with developing programs to help students be better prepared to go out into the real world, especially here in Memphis.
All right. Other questions from our students and our audience members? Oh, there we go.
I have one quick question. Thank you, Dr. Smith-Young. Over here. Hey. Okay, so speaking of homelessness, I'm glad you touched on that. So Baptist Operation Outreach works with Christ Community. We have a free mobile healthcare clinic that serves families and individuals affected by homelessness. And it's interesting you said this. I was curious to know, how do you guys kind of identify? That was one of the questions we had recently, a lot of the work that the city's doing, Mary Young and others, around helping to house homeless youth. how do you identify those kids within your clinics, and you guys connect them to resources that can help support those needs you mentioned?
It happens weekly. Last week I've had to do with that. So basically, a lot of times families, some will come out and tell you. There are other ways for us to see when it comes to prescriptions. We can look in records to see if prescriptions are being picked up. And so sometimes that kind of helps, but it's more so just asking those questions when they come. So we have screening. So I specialize a lot in type 2 diabetes. I have a program called Empower. And so what we do is we try to treat the whole family, but also set goals for those families to be more engaged with the care for the patient and the child. And so some of our questions are about where are you sleeping? How many hours a night are you sleeping? Are there any what we call chaos? Are there situations where you are not able to have a meal, a quiet area, or is there something always going on? And so we just dig into that, just give some type of cues and initial questions that'll make us dig deeper. And sometimes families don't tell you, but a lot of times we find out, just from having that conversation and building the rapport with families. And so a lot of my diabetes patients, I see them every 3 months. So we know each other, so we get to know each other. And if they don't open up initially, they will at some point.
Hi, my name is Stacy Sanderson. I have a daughter who was diagnosed with type 1 diabetes almost 10 years ago, actually at Le Bonheur, and Le Bonheur did a fantastic job. But so what drew you to endocrinology? I know there are a lot of different pediatric fields that you could go into. Why did you choose endo?
So part of it is diabetes in general. Of course, you have type 1 and you have type 2 diabetes. And so being that our area, we have a lot of patients that are, or people in general, that are overweight and obese. And me knowing that people need resources to prevent type 2 diabetes as much as they can, because some people just don't have the awareness of how to prevent it. And so part of that was me wanting to care for people to prevent that, but also the type 1 side. I've had family members, a cousin, that has lost his sight and things from not taking care of himself. So I wanted to make sure that I could be someone that patients could connect to and motivate them to continue to do the best so they can have the best quality of life and learn how to manage things in a way that's good for them. Yeah. And endocrine's challenging too. So there's so many different things, especially when it comes to growth, hormones, and all of those things. It's so many different things to learn about with endocrine.
I have a question that's a follow-up. I'm right here. Follow-up to what Cynthia asked. I'm excited that you're asking questions about health equity, because that's a big challenge in our community. So if Shelby County, we have a lot of health issues, but it doesn't seem that we're moving the needle. And one of the big concerns is having our frontliners be the advocate for the change. And as you mentioned, you try to be consistent with the question. So there are things like Z codes, which are used in in Epic, systems like Epic, where you can be consistent in asking questions about social determinants of health. How can you be an advocate? Not the challenge to you, but I'm talking about being a challenge to nurse practitioners and nurses to be consistent, because I don't think everybody's comfortable asking those questions, because again, you have to build rapport for people to answer those questions. But you could actually meet somebody in 5 minutes and build rapport for them to be able to answer those questions. But we are not doing a good job with being consistent. What can we do to change that?
So one thing that we've implemented in my division, we just switched to Epic 2 weeks ago. So I'm still
We'll pray for
learning. But one thing that one of my attendings developed was a social determinants of health form that our general pediatric offices would use, as well as subspecialties in pediatrics. And so it's a form that has to be addressed. So you can't skip over it. But one thing that I find, yes, you can build a rapport with some, but sometimes it's not what you think, if that makes sense. So a lot of times families will tell the medical assistant or the check-in nurse XYZ. And then when you go in the room, it's something totally different because they're more comfortable telling me, and they're like, oh, I didn't know who that was. I don't know that person. So you have to keep that in mind too. So like I said, dig deep, even though you're maybe getting your answers, they could be false answers. But that to solve some of that, we create a form where you kind of have to, it's a hard stop where you have to address some of it. So, there are trainings that our division that we've done, just to learn about social determinants of health, to bring that awareness to nursing, the MAs, the schedulers, everybody. So you're not, it's not foreign to you, where you're comfortable and it's just, it comes up and you're like, okay, this is what I'm supposed to do. Because it can be hard, initially trying to ask those questions, and you're like, if you don't have an answer for it, you don't know what to do either, and you try to shy away from it. So just, being an advocate, which I love, my group, there are several of us that have worked hard on making sure that we ask those questions. And that's one thing with the type 2 diabetes program that I lead. Like, it's a must that they fill out the form every time they come. And then we do an annual form as well. So
I have a lovely young lady over there with a question.
Hi, my name is Madison, and I would like to be a travel nurse, but my long-term goal is to be a nurse. Do you have any advice that can help me get to my goal?
yes. So I would say if you want to go into nursing, I would at least start off doing like bedside med-surg thing in one space before you do the travel nursing. Only because it's different everywhere you go. Some people love it and some people don't. I never tried it just because I had kids and a family, but I would say, get your feet wet first, just finding, something in one spot stationary before you kind of move around. But same thing, like I said, just making sure that you're doing the science courses and volunteering, shadowing, all of those things. So are you in middle school or high school? Oh my goodness. Okay, senior. So yeah, so while you're in college, so I mentor a girl that's at UT Chattanooga. And so she volunteers at the Children's Hospital in Chattanooga on her downtime. And so she's getting to meet some of the providers there and other staff. And, recently she told me one of the physicians in the ER, she helps with registration, was like, hey, come with me. Let me show you some things. So she's building those relationships and seeing those things. So just talking to people and shadowing while you're in school, but just making sure that you, I say get your feet wet in one place first. And then nurse practitioner, I would always say you've got to do a couple years, med surg or whatever specialty, whether it's, NICU or labor and delivery, like do that a few years because you need to know both sides of things. You need to know how to be the staff nurse, but also be the provider. And one thing with nurse practitioner, you're kind of in the middle because you're not a physician, you're a nurse, but you're an advanced practice nurse. And so we are known for being that person where you can just kind of get everything from that one person, the compassion, the caring piece, bedside manner, all of those things, but also help with the overall outcome of what you need. So just getting your feet wet in the nursing field, whichever one it is.
We have a question over here.
Hello.
Hi.
My question is around mental health and the challenges that we see here in Memphis. So I guess I want to know if you encounter children with mental health issues, and how do you deal with that?
Yes. So that is a daily thing that we deal with when it comes to mental health issues, a lot of depression that happens with the new diagnosis, whether it's diabetes or any other endocrine disorder. So with my group, we had a psychologist at one point, and they moved on during the pandemic. And so what we ended up doing was partnering with another college that has students that are in the psychology program. And so they come and they see our students like 2 days out of the week. Aren't students, I'm sorry. They see our patients like 2 days out of the week. And it helps to build that counseling piece from the healthcare perspective, but we also refer out with places that they can go to based off insurance, which is difficult. And a lot of times, you know, there's only so much we can do. So a lot of times our social worker will give a list of places that they can go or do like telehealth with. And a lot of times families don't do it. You find out a couple months later that they still haven't done it, but they're still screening high on the depression scale when we do this. We screen for everybody when they come through as well. So just trying to encourage people. You know, I had one patient that I was like, just give it one try. I always tell them, just go one time. And, you know, if you don't like it, you know, we can talk about it when you come back, but just give it a try, even if you think you don't need it, because you can see a change in people, especially when I see them, you know, 4 times a year. So, you know, at one point it was hard finding counselors for everyone, which it still kind of is. And so we're building a psychology program at Le Bonheur, which will help us a little bit with connecting families. But that is a challenge that still can't be resolved right away, but we do acknowledge it.
I think it's another area to plug for when we say health is in
Mental
all
health,
spaces,
yes.
and we need more women in health and
Absolutely.
healthcare. That's psychiatric nurse practitioners, another really good job. We had one question online that came in, and it actually adds, you know, a lot of times folks don't know what nurse practitioners do and how they practice as part of the healthcare team. And so the question that came in is, you know, how do nurse practitioners function in the healthcare space, and what is the relationship between physicians, nurse practitioners, physician assistants, and others who you may see when you go in for primary care, specialty care, or hospital care?
So with a nurse practitioner, you do practice with a team. You are considered a provider, but you have your physicians that have gotten a medical degree. And then you have the nurse practitioner that either has a master's and a specialization. You have to be certified in some type of specialty. So my certification is pediatric acute care, or you have some that have their doctorate. But part of that is with nurse practitioner for the state of Tennessee, we have to have a collaborating or supervising physician. So 30% of the things that I do, I have to get signed off by my supervising physician. And whether that's, you know, charts, inpatient, outpatient, and I failed to mention I do telehealth once a week as well. And so those things were do telehealth appointments. So signing off with them, but I have good relationships with I call them attendings, but they're physicians, the physicians that I work with, because nurse practitioners are starting to they're not taking over, but we really are everywhere now. And so people are starting to recognize us. You do get that question all the time from some physicians, what do you do? Or what are you supposed to do? And so, you know, given that definitive answer of how you should practice and what you can do matters. Some states, nurses have their own full practicing authority where they don't have to have a physician sign off. That is something the legislature that we're trying to get passed here in Tennessee. It keeps getting pushed back. But and that's not saying that you're saying you're a physician and that you're opening your own practice and you're going to do what you want to do. It's still, you know, being an advanced practice provider and respecting the level of nursing and physician trained providers.
Absolutely. And I've worked in different states at different roles, and I agree. We're all one big team, and when we all practice to the fullest extent of our scope, the best thing is that we increase access and patients are served to the best of their ability.
To keep increasing the access.
Yeah. We have one more question.
Not one more. I'm
Not
sorry.
one more.
So
Oh Lord.
Piggyback on that. Thank you so much. There's a couple of things I want to lift up to the students, make sure something that you touched on. I think you guys do very well with your work around asthma and realizing that a lot of times when patients get well, you send them back home, and sometimes the environment, how impactful that can be on their health, and end up coming right back in the hospital. I want to make sure they definitely heard what you said about that, how important that is. And one of the things when you talked about nurse practitioner and the medical director, someone wanted to add the DO piece to it. So if you could talk a little bit, you guys, about this whole new model around doctor of osteopathic. I'm not clinical, but we just work with the students. So one of the things though, when we've had students who come and talk to our nurse practitioner at the homeless clinic, one of the things she talked about is why she chose to be a nurse practitioner over MD. And she talked about the the example she gave was around like the system versus the whole person, kind of a holistic approach to health. So I wonder if you could talk about that, one. Two, could you share, do you have any more goals beyond what you've already accomplished, which is amazing? And then lastly, oh, I'll let you stop there. Let me read and make sure I got the rest. Did you have any more educational goals? But can you tag on the DO piece and how you understand nurse practitioner's way of treating versus an MD? Sorry. Is that good?
You take yours, I'll take ours. We'll just go like this.
Okay. So, as far as the way we treat, I feel like most of us kind of treat the same. Of course, the MD has more medical training when it comes to learning the whole overall picture, more so like trying to make this simple, like patho and the research part of things when it comes to clinical trials and things sometimes. So that's the difference. As far as with me, why I chose nursing instead of medical school, part of it was I wanted to, and this is not discouraging anyone from medicine because I want you to do that too, do what's best for you, but I wanted to have more of a balance when it came to family. And when the point in my life, it just, I needed something that I could do that could support my spouse as well with his endeavors. And so nursing, I just love the piece of the bedside connection of nursing. And most people remember, if you were in the hospital, you may see 10 or 12 different people a day when it comes to your PT, OT, the residents, every subspecialty, whether it's your heart doctor, kidney doctor, but you have that nurse all day long. And so a lot of patients remember the nurse. And so that was one thing that I just, with family members as well, I wanted to do the nursing side. Trying to remember the DO question. I'll let you answer that.
Yeah. So so we're very excited at Baptist to have a College of Osteopathic Medicine. And so if you are interested in pursuing becoming a physician, a licensed physician, there are two paths in the United States. There's allopathic medicine or allopathic medicine, and there's osteopathic medicine. The distinguishing feature of osteopathic medicine really is the neuromuscular, holistic approach to care. And so being able to think about how the body works both in its physicality and in its biochemistry. And I know my uncle's a DO, so I actually have a real soft spot for DOs. That ability to see that whole person and really that intermuscular connection is something that's very unique to osteopathic medicine. And often osteopathic medicine providers, they're in every specialty as well, but they do have a heart really for some of the more frontline medical practices in pediatrics, primary care, family medicine, and obstetrics and gynecology. So it is one of those areas that does have a heart in the community in particular.
I work with a lot of DOs and MDs as well.
We love Lee County. Any more educational goals and what's next?
More educational goals for me.
Are you sure?
Yeah, I focus on my children. But yes, I am happy. I love what I do. So I definitely don't plan on going back to school. I always have challenges that I would love, to
Never
maybe
say
advance.
never.
Being that nurse practitioners are starting to grow in all of the fields, I would love to possibly do leadership at some point to nurture and help enhance the nurse practitioner role in facilities. But other than that, I'm happy.
Love it.
There is one more question
Yeah.
online.
Oh, good. And there's one more up there too.
All right, so the question, can you share some of those HIV stats for Shelby County?
don't
Oh.
have all those on me.
Yeah.
So I don't have the stats because I hate to quote wrong, but you can go on the Shelby County Health Department's website for that. I can tell you what I learned from doing the program, which was a few years ago. A lot of students, of course, feel like, they are not a part of those numbers and won't ever be a part of it. And so they don't think about sexual activity that they have. One of the things that I ask for all of my teenagers that are 14 and older, when I see them, I let the parents leave out of the room sometimes to ask, are you sexually active? And so making sure they understand what that means, because some people don't understand what sexually active is. And so there's so many different parts to that. But the rates are high because a lot of teenagers are swapping girlfriends, boyfriends, all of those things, and they're thinking that nothing can happen to them. So, we have to do that piece of just being advocates and encouraging abstinence or safe sex, whichever it is, until you are well informed on how you should be when it's time and when you make that choice to be sexually active.
We have our last. She gets our last question.
Good evening, everyone. My name is Michelle Kitson. I am an internal medicine physician. I'm an MD, so I can give a little bit more on a couple of the things that were mentioned. HIV in Memphis, we are the number 2 in the country for new cases age 14 through 35. I need you to hear me again. Number 2 in the entire country. New cases of HIV in the 14 to 35 age range. That is horrendous, guys. That is really scary, because you can't look at someone and know they're HIV positive. And that's why when you're driving with your parents along the highways, you're seeing these big signs about knowing your status. It is incredibly important. We've had outbreaks, clusters of HIV in middle schools and high schools. So it is very important for parents to not take this attitude that because your child isn't telling you whether or not they are practicing any kind of physical intimacy with someone else, it does not mean that there is not opportunities for exposure to HIV. Now, when I was a teen, many moons ago, I was petrified of HIV because everything we saw, the people that we saw on the television, the actors, the actresses, the common folk, everybody around, it seemed like it was a life sentence. It was absolutely a terminal disease because there were no treatments. Today we have Magic Johnson, who was one of the biggest persons who admitted to being HIV positive, and he's lived a tremendous life and a tremendously long life, relatively healthy life, and treatments have changed tremendously from when he was first diagnosed. So I say this to you to say it is now being treated just like hypertension or high blood pressure, just like diabetes, because you can live long lives with the disease. That what I'm wanting you young people to know is you don't have to have that. That's one of those that is clearly preventable. And so seek guidance from your parents. If you feel like you're not able to get your parents to have that discussion with you, it has to be a trusted adult. So like your pediatrician, like your family physician, if you see a family physician, nurse, counselors at school, have those discussions, because it's very important that you not have to be chronically treated for a disease that is absolutely preventable. So I did want to share that. The other thing is just to give a little bit of an add-on to the discussion. As an allopathic physician, if I compare myself with my DO counterparts, the emphasis during our training was less on the add-on type therapies. And by add-on, I mean things like acupuncture, things like, a real strong emphasis on diet and how diet prevents disease, as opposed to, okay, we're going to fix you after you've gotten a disease. And so our colleagues who go through osteopathic medicine are trained much more in those areas. There's more of an emphasis there. So manipulative therapy, physical therapy, and the like. Now, it doesn't mean that as an MD, you don't learn those things or don't practice those things. It's just the focus during training was not heavily on those things. And if the truth be told, learning those kinds of things to prevent you from having to take medicines is a much better way of doing things. So food as medicine is really important. And unfortunately, that's not something that we, in general, as a society, do a very good job of, as far as how, eating. And then to piggyback on, or to tie it all up in terms of how we all function within the team and the system, doctors can't do their jobs effectively without support staff. And so there have been times where there seems to be disrespect between, the physician, the attending physician, be he or she an MD or a DO, and our nurse practitioners and our physician assistants and our PT and RT and different therapists. The goal has always and should always be the patient and the patient's family. And as long as all of us are focused on that and less on egos and the like Dr. Young said, the truth of the matter is, with all the demands on the physicians, they're running from room to room to room. When you're admitted to the hospital, it's that nurse who's on that 12-hour shift that you get to see that whole time. And so oftentimes when a question comes up, they'll be the one right there able to, if not answer your question, then at least articulate that to someone else who does have the answer to that question. And so we can't do our jobs effectively without each other. So I did want to make sure that we made that clear. I love that Dr. Smith Young said that she did med-surg and she's recommending that med-surg be a core part of your training before you go off to become a nurse practitioner, because the truth of the matter is you learn so much, just like we do in our residencies and our clinical training, where we spend hours and hours interacting with patients. If all you've ever done is read something in a book, I promise you it looks very different than seeing it on a patient. And another thing is, guys, advocate for yourselves and your family members. It's okay to speak up. Most hospital systems will have a patient advocate or somebody who will take your feedback to heart. And if the doctor seems a little snippy or doesn't seem to be listening to you, and you keep asking questions and you're feeling that you're being dismissed, you have the right to change. Like I tell people all the time, if you're a coffee drinker and I'm a tea provider, maybe I'm not who is going to be a good fit for you. And the truth is, you want the absolute best care that you can get for yourself. So please, 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 if someone's getting a scary diagnosis, a type 1, a type 2 diagnosis, diabetes diagnosis, a cancer diagnosis, sometimes they check out. They don't hear anything else after they've heard diabetes, cancer, some such thing. So if they don't have somebody there with them who is tuned in, then they could be not in saying yes and be completely in the dark because they stopped after they shut down. And so it's very important to go ahead and make sure that we go as teams to the doctor, have somebody who is a little bit removed so that, they won't be crying harder than you when you get the diagnosis. Those people aren't really that great, but somebody should be there with pen and paper, pencil and paper, writing stuff down so that if you need to get an explanation later, somebody can articulate that for you. And with that, I'm shutting up. So
Awesome. Not that you ever have to shut up, but we have one less. Okay, yes.
Hey, my name is April. I'm a sonography major, but I just have one question. It's not nursing. What advice would you give if I wanted to go into public health or health administration?
Same advice as far as like shadowing, like kind of seeing what it is like a day's life with it, like, and so getting to just finding out who's in that world, that spectrum, and shadowing to make sure that that's what you want to do. Explore the programs. So of course there are lots of public health programs now. There weren't very many when I got my degree. Yeah, we didn't have one locally, so that was kind of why I did the online route with that one. But explore and see all the programs that are out there, because there's so much available, and just see what you think would spark your interest and see which one you'd want to do. But you can do both, the healthcare administration and public health, because those would go well together. So yeah, I would say. You don't have to have a bachelor's in management. And I don't know all the requirements for schools, but you know, some will make you take a GRE, the graduate exam. Some don't. So that's what I said. You have to kind of look and see what programs and what schools ask for what. But most places you don't have to have a bachelor's in like management or anything like that. It can be a science background or whatever. You just would probably have to take like some prereqs. If you don't have those courses already from your degree that you have already obtained, then you may have to take some classes before you can get in. That wouldn't hurt. I mean, but
Right? Like, if you have your bachelor's in management, would you go into public health or would you go into health administration?
It doesn't hurt. You're asking me?
Yeah, I am. Yeah.
Ooh. Oh goodness. I would probably do public health. Yeah.
Awesome. Well, we have actually we got all right. I don't think we're letting you leave, but yeah, please.
I would say so. I had some mentors. Some of my cousins are physicians, and so you know I would talk with them about things. But I didn't have a female mentor growing up, and so that's one thing that I try to strive for now, to make sure that I connect with young girls. And like I told you, I was shy growing up. You know, I kind of came out of my shell at some point, but I did not have the female mentor, if that makes sense. Mm-hmm.
All right. Do you want to yell, or I can walk up to you? Summer program for seniors and juniors. So I think yours first.
So yeah, there are a couple of programs which I'm gonna get in trouble. But yeah, so LeBonner has what they call the Volunteer program. And so it's for juniors and seniors, and you apply the summer before, or the spring before your junior or senior year. And so basically it's some people do 1 week, some do 2 weeks, where they go and they get to see all of the different areas in the hospital. So you can hang out with pharmacy for a minute and see what a pharmacy tech does. you hang out with some physicians, you would hang out with physical therapy and occupational therapy, radiology. And the years that I did it, I was doing pulmonology, so I would show them, I think the picture you saw with the kids with the clips on, that was them doing what we call PFTs, where we're trying to measure their airway and them, how well that they're breathing and the capacity of it in the short term, to see how well controlled they are with their asthma. And so I let those students do that and what we perform the patients, how they perform it. And so just exposing them to that side of things that each subspecialty or each discipline does in the hospital. So you could decide, ooh, I actually never thought about radiology, and now I think I'd like to do that. So Bonner usually puts those applications out, I want to say like in March, April, just kind of look at the early spring kind of, and just it's on the website for that program. And but yeah, and I'll give you my contact information, but it always helps to talk and meet people. But if they're interested in doing that, that's something to apply for. I know the University of Tennessee has one as well that they're starting up again. There's a couple programs with the Memphis Museum of Science and History on the board there, and so we're working on a collaboration as well with middle and high school students to introduce them into the research and tech part of science and all of that stuff. So there are lots of different things, but going on the websites and looking, there are lots of programs. If you just go on like uthsc.edu, and I know Baptist has one, so I'm gonna let them do the plug as well, since that's what I'm here for. It's like I didn't want to talk about everywhere else. So,
well, the great thing about being in Memphis is that we're a healthcare mecca in the Mid-South. Like, we are very blessed to have Baptist and Le Bonheur and Methodist and Regional One and St. Jude's and all the others. So there's a plethora of opportunity, which is a wonderful thing. And the fact that we do collaborate together is unique to this area and something to be very proud of. So I'll give you the spiel. So I am the co-chair of Health Corps with Dr. Ndodo, and we have two big programs at Baptist in the summer. We have our summer camp program at the university that brings together all of our different agencies under the Baptist umbrella, and we do middle school and high school students, and they get to go see professions. I know my favorite one was when we solved murders and did forensics in the lab, and when we played the game of the missing thyroid with Dr. Ndodo and I, and had students working in medical sonography. The high schoolers actually and middle schoolers got to use that on real people and say who has a thyroid and who doesn't. So it was super fun. And then our hospitals, each in the different areas around the Baptist system, have a summer crash program, which is probably a little closer to what Le Bonheur does, where it's an intensive week in that hospital, specifically looking at hospital-based practices and careers. And that, I would say, and I think this is fair for all the universities in the area, tend to be a little bit broader because we have more things that are health related. And as I'm an economist, so I will tell you that 1 in every 6 new jobs is in healthcare. So if you weren't convinced tonight hearing this awesome story that this might be a place for you, I hope you are now. And 1 in 8 of all jobs in the United States are in healthcare. So we're a big place, and there's a lot of opportunity, and we need all of you to be a part of that in the future. Nope, I'm not letting you ask any more questions.
No, we're not adding questions.
Yes. We do.
Yeah.
Yes.
Yeah. Backman. Backman to white coat. And you can shadow as well. You could do shadowing. There's a link that we could share for that as well.
Okay. So we unfortunately have come to the end of our time. We do actually, for our students that are here locally and for our students in Lee County, we're so glad that you are able to join us. All of our students, our parents, our professionals, thank you so much for being here. I think we all agree Yes, we have to take a picture or I'll be fired. Group photo. Lee County, you have an assignment. We'll take a picture here at the end, and then we have something to do for the students. But I think first we should really give Dr. Smith-Young a wonderful round of applause for all of her great advice. And with that, we will sign off. We hope to see you on November 7th on the Baptist Health Sciences University campus for the 3rd annual Tennessee Health Career Summit and Expo. It's open to Tennessee, Mississippi, and Arkansas. It's just Tennessee started it, and so our name goes first. We'll eventually broaden the title. And please connect with us on our socials and all the other things so that we can connect you to all of the wonderful healthcare resources and careers that Baptist as well as the greater Mid-South have to offer. So thank you to Lee County, and thank you, Dr. Smith-Young.
All right, people. All right, let's come
The
to the
assignment
front.
is